to have you here with us again.
Thank
Thank you
you.
so much. So let's just dive into the question and answers.
Hmm.
And everybody asked us to do a live session on seasonal depression, and it has been a very, picked up topic these days. And everyone has been suffering from it, or are seeing symptoms or like indications that give us an indication. But rarely people know about what seasonal depression or seasonal affective disorder is. So starting from the very basics, what exactly is a seasonal affective disorder or seasonal depression or winter depression as we name it, and what causes it?
So, as we understand it from a mental health perspective, seasonal, the word says that with the change of a season, and affective is means mood. So, there'll be a change in the season and there'll be a change in the mood. So, classically, winters bring a lot of blues and they bring a lowering of mood, body shutting down, lowering of energy levels physically. Similarly, it happens to the brain, and you feel a certain sense of slowness, you certain sense of uh, tiredness. You feel like sleeping more, and so seasonal affective disorder or a winter depression is a type of depression, and classically happens at the change of the season, and majorly it is at the onset of winters. So that's seasonal affective disorder. But um, if we compare with the tropical and temperate climates, if we compare with our country with as the continent and the country is going towards the poles, you find that the season variation is much higher at the poles. So the amount of light that is received, especially the sunlight, the natural light, the amount of light received in winters goes very less. So one hypothesis is, which is proved in the intervention, one hypothesis is that lowering of light and less amount of light received in the eyes, not on the skin, but in the eyes, create less amount of serotonin, more amount of melatonin in the brain, and then it causes depression. So in treatment, people use light therapy. They have big, huge bulbs and they expose themselves to that light, and that helps in elevating depression. So some amount of truth is there that less amount of light and chances of having depression in winters.
Okay. And you just mentioned winter blues. Is there any other season in India or in any other country that also affects this condition?
So many tropical places do talk about blues in the rainy season because the winters are not that harsh here. So when the rains are very heavy and there is a lot of rain and very limited amount of light, cloudiness, and especially in the monsoons. So tropical countries face a lot of low mood and fatigue and tiredness in the rainy seasons, and there is a lot of gloominess around. And sometimes when that fall starts and the rains go away, you actually feel better.
And what are like the best simple ways to identify it if if I barely know about winter blues or winter depression? So how can I identify the symptoms?
So similar to depression, if we talk about it, there is a lowering of mood, and usually a person will realize that they are not like that, and there is a lack of drive and the lack of interest or excitement, especially in things which they used to enjoy. So if you enjoy reading, you don't feel like doing it. If you want enjoy walks, going for walks, you don't like doing it. So you'll not derive the amount of pleasure that you were deriving earlier. And then there are negative thoughts. You feel everything is very hopeless. You feel you are not able to do stuff. There is a sense of helplessness coming around. Everything seems negative. So this expression in terms of your own emotion, and then physically you will have increased amount of sleep. Winter especially will have a lot of sleep, and you don't feel like getting up in the morning. You find it very difficult to be more active and alert and fatigue. So all of this combined together, lasting for 2 weeks or more, present throughout the day, will get into the domain of depression. And one can realize this not just by their experience of depression, but also with the fact that it will start affecting their personal life or social life or professional life. And when there is a dysfunction, then we go into depression.
And is there any change, like major change or a minor change in no, like depression, regular depression, and seasonal depression or seasonal disorder?
So there is a very subtle difference. In seasonal depression, the chances of gaining weight, eating more, craving for carbs, and sleeping more is generally the hallmark. But in depression, not only you can have this, but you can also sometimes have reduced sleep. So a lot of people have insomnia. A lot of people say they don't feel like eating. They'll actually lose weight. So that can be the reverse part of it. So depression mostly will have uh, seasonal depression as a subcomponent. So it fits into depression, but depression doesn't fit into seasonal depression.
It's an umbrella term, like depression is an umbrella term and it can be subset of it.
Yeah, I didn't get that. Yeah.
Depression is an umbrella term that
Yeah.
we can use
Yes.
and it
So
can be
depression, you can have
depression.
varieties of depression. So, but seasonal disorder, seasonal depression is a type of depression.
Correct. Okay.
So
Okay.
sometimes you have to differentiate that. And especially when there is a sudden change in harsh weather, which the last 1 week or so we are noticing here in North India also now, that there is a spike in the cold wave and there is a sudden drop in temperature. So the depression will set in now. It was not happening, let's say, a month back. So this category will fit more into the winter depression.
And you just mentioned about light, and I was having a conversation with one of my colleagues also, and they mentioned that the lack of sunlight can also cause like winter blues and everything like that. So, are there any treatment options for seasonal affective disorders, and are there any home remedies or home techniques, for example, getting lunch outside or like in sunlight? Or things like that, engaging in a hobby, things like that that can help us come out of it.
So three things that we have been learning right from when we were in school. So every time that winter would set in, there would be a lot of emphasis on doing physical training, PT exercises in the morning, and trying to sweat it out. So when you do a lot of physical activities, especially when you are outdoors, by default, whatever sunlight is there, you get exposure to your eyes. And physically, when you tire yourself, there is a lot of endorphin release in the brain. So that definitely counters the blues that are setting in. Physical activity really works. Exposing your eyes to natural sunlight. It need not be on your body. You don't need to actually sit in the sun and let it soak in. But your eyes getting sunlight, a direct or indirect sunlight to your eyes is more important. So 15-20 minutes, half an hour in a day usually works pretty well. And there's another aspect which we people don't realize. In winters, they find it sometimes difficult to get up in the morning. But it becomes more important that you leave the bed at a certain time in winters. Whether you may not want to do anything, you may just maybe sit on a chair next to your bed, but leaving the bed creates that sleep cycle regulation, which winter needs very importantly. So that helps. People uh,
And that is
ob- obviously, when people have depression, they do need to talk it out, and you need to have certain amount of counseling. And in extreme cases, you where the dysfunction has set in, then there is a requirement for medicines. So for that, contacting a professional would really help.
absolutely. And are there any dietary options also that can help with it? For example, there are seasonal fruits or vegetables too that eating that also have an effect on it.
So in terms of diet, we always maintain that there should be a balanced diet, protein, carbohydrates, and fat, and any kind of seasonal fruit or seasonal vegetable really helps. unless there is a contraindication. Let's say if somebody has diabetes and they are not supposed to eat a lot of sweet fruit or something. So that's a different matter. But fresh out of the season would work ideal.
And like depression, is seasonal depression a lifelong condition or a disorder that will always stay with you?
So when we try and manage a problem, it stays on. So every season that you work on it, you tend to find that it's repeating again and again and again. But if it has set in as a disorder, if there is a dysfunction in terms of personal, social, or professional, any two or all three, then it is definitely set in as a disorder. This gives you an opportunity to work at the brain receptors. So if you do a structured cognitive behavior therapy or any other kind of therapy, there are brain changes. If you go in for medicine, there are changes in the brain. So the ability of the brain to regulate serotonin usage rather than focusing on production helps in, even in winters when the production is less, the brain does not go into a depressed mode. So I have found a lot of clients for years together having seasonal depression come in for treatment. We do the treatment, let's say 3 months, 4 months, 6 months, and before the next season sets in, they are off medicine and they don't find this kind of a seasonal variation ever again. So now, interestingly, if you are having just blues, you anyway don't need treatment. So the question of disorder doesn't come. But if there is the depression that is set in, seasonal affective depression or seasonal affective disorder, then you need treatment and then it doesn't repeat.
Got it. And since depression or disorders make it quite difficult for us to work, or students get distracted from their studies, so do you have any tips for students or working professionals who are dealing with the condition or living with it, to deal with it in a much better way, or to navigate work and their studies together?
So for each one of us, especially for students, and especially when you have system-based work, let's say you're in an office where you're sitting in a cubicle and focusing on a system and you don't have any windows, and so it's not possible sometimes to always, you can't just leave the classroom and go and sit in the field, or you just can't leave the system and go outside and uh, expose yourself to the light. That's where exercise plays a role. Physical exercise, rigorous 15 minutes worth of rigorous exercise every day, especially if done in the morning, would give you, charge you for the day. And a good amount of relaxation when you come back in the evening. You go to the night and you, before you go to bed, you can do a lot of like something called a Jacobson progressive muscle relaxation, JPMR technique, where you can relax your body and then you close the day. Sometimes we also ask people to, because there is a lot of cognitive element involved, there is a lot of thought process involved, there is a lot of negativity involved, there is a lot of ruminations. You're stuck with what you have been doing in the day, and the night everything is just churning, churning, churning. So I ask people to just write it down, maybe in a diary, maybe sit for 10 minutes, just write stuff down, close the diary, and then just go to sleep. So suddenly all that excessive rumination, thinking, unnecessary thinking is crystallized on paper. You write it down. You don't need to read it, what you have written. Just close the diary, go to bed, and things sort it out. Then you have a dreamless sleep, you have a relaxed night. And then morning, there is a fresh start. And morning should not be started with cognitive exercises or relaxation. It should start it with exercise, physical exercise, something which you don't need to play the mind on. If you do physical activity in the morning, is the best.
All right. So these were all the questions that we had, the team generated, and we also have some questions from our communities. Uh, so we would just like to take you through that.
Yeah, yeah, absolutely.
Somebody has written, what are the symptoms of uh, anxiety, and what are the treatment? What is the treatment for the same? And they have been having anxiety during the winter season.
So, anxiety as a part of depression is seen quite often, and it's slightly different from depression. So, because what happens in anxiety is that there are a lot of physical symptoms. You
Mhm.
have palpitations, you can have constriction in the chest, you can have dryness of the throat, you have a choking sensation, you can have shaking of the body, hands and extremities become very cold, and you may have a lot of sweating. So these are physical autonomic dysfunction where everything becomes very restless. In fact, you can check the pulse, you'll find your pulse is shot up. Maybe sometimes blood pressure is shot up. So there is a lot of confusion between a cardiac event or maybe it's something physical. When depression adds to it, you have thoughts also. So you'll be thinking a lot, you'll be thinking negatively, and then the anxiety and depression merge together. When you have only anxiety, then most of the people they do not on initially they do not reach the psychiatrist or the mental health professionals or psychologists. They keep getting their tests done and again, and if a basic assessment has been done, you have some basic parameters, blood work done, cardiac activity checked, ECG, chest x-ray, everything is okay, then it's best to then go to the next professional. And the treatment modality remains similar because both are from serotonin. So interestingly, a person who is having a palpitation and a cardiac rhythm problem, the doctor will tell them to take rest. Whereas in anxiety and palpitations, we would say go for more rigorous exercise. So the nervous system strengthens and the body relaxes. So anxiety is easy to treat. The time taken to diagnose and treat sometimes is a longer period than depression.
Okay. So this was a question asked by one of our members from Sheepida Women's Health Community. And somebody along with them asked, if I have depression or anxiety or seasonal depression, can it also affect my decision making and cognitive skills?
So understand something, and this is where people do a lot of mistake. Depression and anxiety, where we are talking about it, is a disorder. We are talking about a disorder. We're not talking in terms of the manifestation just as a reaction to an event. We are saying we're talking about the body and way brain changes and negativity. And the key here is that in this disorder, you lose control over your thoughts and your emotions. So now imagine that you are in a situation which requires your patience, which is testing your patience, and you lose control. Then realize that the probability of you doing a mistake is much higher because you have lost control. You lose control over your thoughts, you lose control over emotions, and for that brief period of time, it will result in skewing, it will result in the decision making getting affected. And later on, you regret that when you are relaxed, calmer, and uh, everything becomes better. And then you start creating a situation where you realize कि अरे यार ये तो मैंने गलत decision ले लिया. So control is the key, and that's what we give back. We want to give back control.
Got it. Uh, so that were the community questions. We also have some questions in the comment section. Amay has asked, do sad lamps work? I don't know what that is, but do sad lamps work? If yes, how can someone with migraine adjust to these lamps where the sun is out of sight for days?
Migraine.
Yes, sad lamps and migraine.
So migraine is a very different. I'm happy that somebody has mentioned migraine because migraine and depression, migraine and anxiety, migraine is a neurological situation, and depression, anxiety goes into the psychiatric domain or the neurochemical domain. Whereas migraine is a vascular area. For example, if you get exposed to bright light, now if you have a migraine problem, you will have classically one-sided headache. And the moment you have bright light, or you have a strong smell, or you have stress, or you have a loud noise, the blood vessels in the area of the head will expand and there is a rush of blood to the head. And this causes the pounding headache. So that's migraine. We are talking about not the vascular system, we're not talking about the blood flow. We are talking about the nervous system, the nerves. So in case of depression, anxiety, many people have a lot of headache, but both sides, and not just one side. So both sides, and this is a stretching pain, stretching kind of sensation. So this is migraine is vascular blood supply, and what we are talking about depression and all is nerves. So when we give light, you can actually trigger migraine. But when we give light, you can alleviate the pain, the headache, which is coming from depression. So this is different, totally different.
The next question is, could you please uh, tell us about primary prevention of medical illness? Okay, this question is not about seasonal depression, but if you want to take
So
it, we
prevention
can.
is always better than cure. We always know that. In when we do the medical training, there is a department called preventive and social medicine. We talk about primary prevention, we talk about secondary prevention, talk about tertiary prevention. Prevention means trying to create a situation where the possibility of contracting an ailment goes away. Now, unfortunately, in mental health, there is a lot of work on genetics also, but unfortunately for us, we will not be able to preempt and see how we can avoid an ailment. You can obviously work on your mental well-being, and to improve a well-being, to do prevention of an ailment, it is best to have a work-life balance. It's best to have a balanced diet. It's best to have a physical exercise regimen where as which is age appropriate, which is your body needs appropriate, and improve well-being. And a lot of therapists and psychologists will talk to you about mindfulness. They will say that be focused in the moment, be here and now, don't deviate, don't live in the past, don't worry about the future, live in the present, live in this moment, live in this session. Don't think what's going to happen after the session. So focus. And that helps. Having recreation, having hobbies, laughing, adding humor to your life, doing altruistic activities, going out, helping people, not expecting anything in return, be selfless, really improves serotonin for a person. Personality development in terms of cognitive behavior therapy, learning how to improve your coping skills, not get bound by negativity which is in within yourself or outside, trying to live rationally and not emotionally. These things help, makes you a better person.
Okay. Uh, somebody has written Anupama. Her daughter is having difficulty in studying, just as we discussed earlier. So I already have anxiety disorder. I am on medication, so it becomes difficult for me to study in winters. It's about her daughter. So what should she do?
So if we are talking in terms of disorder, whoever be the person, like it can be a daughter, it can be a son, it can be the mother, it can be the father. Interestingly, what happens in mental health is the key part. It affects everyone in the family. This is not like typhoid, where one person is having chills and upset tummy and antibiotics and staying in a corner and everybody is sympathizing and taking care of them. When a person goes through a mental illness in a family, the whole family responds to it. And there will be something or the other happening to everybody around the individual. So when we are trained to work with family members, we're trained to work with the caregivers to make sure that they themselves should not get burdened by the ailment and vice versa. So we need to be aware of two things. One is called expressed emotions. So if a client is unwell and the caregiver is taking care of them, they can be over involved, they can have criticism, they can have hostility. So we have to avoid all that. Second, we don't have to think that this is happening in terms of the behavior or the environment, but this is more physical. It's like having fever. It's like having 102 fever. So what would you do then? So the same thing you can do when there is anxiety. So that's how it's the best way to approach the problem.
Uh, there's just one more question.
I think you missed a
I
question on top, which says that
mm,
doctors say that the medicines. Is it true that when doctors say you don't need to take medicines for life, or they're just giving false hopes?
yeah.
Well, I would like to touch this because this is very interesting. Which medicine? The question is not medicine is for life or not. Which medicine? So, for example, my medicine is 2 shots of vodka in the night so that I can sleep very well and forget all the blues. This is for life, and it's not going to stop at 2 shots. It's going to be 4 shots, then 8 shots, 10 shots, till I drink a bottle and sleep. So, is that a medicine? That's not a medicine. Similarly, sleeping pills and anti-anxiety medicines are not medicines, they are supports. The only medicine in depression is serotonin. Counseling will also improve serotonin. Serotonin supplementation like SSRIs are serotonin. You cannot take serotonin for life. You will not be able to take it. If you add an anti-anxiety to it, if you add a sleeping pill to it, you will be able to take serotonin for life because those are addictive. So in your prescription, a doctor needs to, and the client needs to understand, they need to step down from the anti-anxiety and the sleeping pills once the system is in order and continue only serotonin molecules. So when you take a serotonin tablet only, you will reach a point within 2 months, 6 months, 8 months, 1 year, not anywhere between 6 months to 1 year, where you will be forced to stop this medicine. You will become drowsy, sleepy, lethargic, and you will have to then stop it. So there is no false hope here. This period of 6 to 12 months is only after recovery. So if a client is in depression and recovered only 60%, they have not reached their pre-morbid. They have not reached that point in their life where how they used to be earlier, they've reached that now. That's not yet happened. So the maintenance phase doesn't start. So the first step is to achieve recovery, step down from the medicine and continue only the serotonin in proper doses, proper quantities, whatever the body is utilizing. And 6 months, 12 months, you'll be off medicine.
I hope that answered your question, Khanesha. And he has again asked on the same question that he has been on medication for 5 years. So
So
I hope
review
that gives you
the
the answer.
prescription. That's what I'm saying. I have had people who have come to me with 30 years of medicine. And when I ask them, show me the prescription, there is always one molecule somewhere in the prescription which is creating the problem.
Yes. So that were all the questions in the comment box. So we'll just read them. Yes. So these were all the questions that came up in the comment section also. And if anyone has any other questions, you can definitely drop them in the communities that we were just talking about. The link is in the bio, and you can just click and join the communities and send us your questions so that Dr. Sameer can take those questions in the next live session. So thank you so much, Dr. Sameer. It has been a lovely session. It's always lovely to have you with us on the live session. And
Thank you.
thank you so
It's
much.
been
The
fun.
audience
Yeah.
loved it.
Yeah.
Thank you
Thank
so
you.
much. Thanks for your time.
Right.
We'll see you again.
Bye.